Hey everybody, today we are back with our friends at South Texas Brain and Spine Center. I am here with Dr. Alexander. The doctor is in the house, y'all, and we're here to talk about something very common, sciatica, that sciatic pain that I think a lot of us say, hey, I'm just getting older, this is one of the first pains that we have to experience and I'm just going to have to deal with it. But there's a little bit more to it, isn't there?
Yes, it's actually a pretty common problem. So this is a model of the spine, and so how we break it down, this is your cervical, thoracic, lumbar, sacral, and we label the disc what's in between. So the discs are like shock absorbers, allows to have motion, impact, over time, wear and tear, getting older, lifting things, it can cause damage to the disc. And so it can cause, this is an example of a disc herniation that causes pressure on the nerve, and the nerve goes into the sciatica nerve and comes out. So patients complain of pain down into their calf or down to their toes, and it usually can associate with weakness, numbness, those type of symptoms. That's sciatica or radicular pain. And so typically, depending on the disc and how the symptoms are, we typically treat conservatively initially. We do physical therapy, we have them see pain management, do epidural injections. Sometimes they're very large disc herniation or they have a major neurological deficit. So things that we worry about a lot, if you have bowel and bladder problems, that's very serious because that can be irreversible. If you have foot drop, so a 4 or 5 disc would cause foot drop, and people who kind of bang their foot, they're going to drag it, it's called foot drop, and that's something that needs to be treated more urgently. And so don't ignore it. Some patients will come to my office and they have 6 months of foot drop and weakness, and they see everything else except a surgeon. I mean, typically we're pretty conservative in our office. We send you for conservative treatments, but if you need surgery, you need surgery. So we like to help guide the treatment pattern.
Prevention-wise, I feel like herniated discs, I mean, is this something that just happens inevitably? Are there things that we can do on a regular basis to try to prevent these from happening?
So we try our best, but lots of times we bend over incorrectly, and we bend not with our knees, we pick up not with our knees. And people who have knee problems, those they kind of use their back more, and that causes more stress on your spine. And then even exercising, if you exercise and do squats and heavy clings, that causes a lot of stress on the spine, and I see that commonly with large disc herniations from that too. So certain things we can prevent, certain things we can't. You know, I have patients who carry their child and then all of a sudden they experience back pain. Well, I mean, it's unfortunately, you got to be careful. I mean, you can't carry 40, 50 pounds. Our body's not meant to be abused.
Absolutely. And honestly, these things usually happen in the most embarrassing way, right? You're like, I blew out my back. How? Well, I was tying my shoe. I was getting out of the car, something simple. But that seems like a catch-22, right? Because exercising and lifting and doing compound movements should help your body chemistry and help you remember to lift things properly to avoid this. So is there a sweet spot somewhere in there?
Yeah, I mean, you want to work on your core muscles, exercise, do sit-ups, do leg raises. A lot of times we focus on our upper body instead of our lower body, but our spine, all this lower back is your whole body is based on. So if you don't strengthen that and you don't exercise that, it's going to get weak with time.
Okay, good to know. And in order to seek your services, do we need to have a referral from our primary doctor, or can we just schedule an appointment?
You can schedule directly with us. Sometimes certain insurances want to have a referral. Depending on the insurance plan, they need to have a referral to see a specialist. So, but we're happy to see anybody.
Great. Okay, stop by and see Dr. Alexander and the team here at South Texas Brain and Spine Center. And of course, as usual, don't forget to mention Coastal Living sent you. Thank you.
Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.